Hi everyone, my name is Neha. I am an internal medicine resident from Advocate Christ Medical Center, and I will be talking about a rare case of paralysis and thyrotoxicosis. I have no disclosures. These are the following learning objectives. TTP is a rare and sporadic condition characterized by the acute onset of paralysis and hypokalemia in a thyrotoxic state. In patients with hyperthyroidism, the high thyroid hormone level increases responsiveness to beta-adrenergic stimulation, and the thyroid hormone itself, along with the beta-adrenergic stimulation, increases the activity level of skeletal muscle sodium-potassium ATPase pump. This leads to more potassium being shifted intracellularly, leading to hyperpolarization of skeletal muscles, causing ultimately paralysis. My patient was an 18-year-old Hispanic male with known Graves' disease. He presented with generalized muscle weakness more prominently in his lower extremities, leading to the inability to ambulate. He did have similar episodes of this in the past, which all happened after consuming a high carbohydrate meal, such as after Thanksgiving Day or after vigorous exercise. And the current episode, which brought him to the hospital, was preceded by drinking large amounts of soda the night prior. He was also non-adherent to his thyrouracil medication. On physical exam, he had objective lower extremity weakness of 3 out of 5 strength bilaterally, symmetrically, and 4 out of 5 in the upper extremities after some improvement already on our time of exam. His labs show that his potassium on admission was 1.6. His TSH was 0.008, and his free thyroid hormones were markedly elevated, as shown. After ruling out other causes, TTP was ultimately diagnosed, and he was treated with potassium replacement and methimazole. On day 2, his symptoms fully resolved, and he was discharged with a normal potassium level. TTP is a very rare disease, which most commonly occurs in East Asian descent, however, does happen in other ethnicities. It's important to identify it urgently. It has the classic presentations of acute onset of paralysis affecting proximal muscles symmetrically, with lower extremities being more affected than upper. Large carbohydrate consumption and rigorous exercise can trigger this due to increase of insulin shifting potassium intracellularly and the stress hormones being activated affecting the sodium-potassium pump. Patients who develop this even once should undergo counseling on how to avoid triggers to decrease future risk of TTP. This is important as TTP can be life-threatening due to arrhythmias and weakness of respiratory muscles, requiring ventilatory support. Adherence to medication is also critical because euthyroidism prevents TTP attacks.